Hi, Jimmy. Good morning.
Good morning.
It's good to see you again. We just wanted to know that your voice is clear, and we wait for Alan to join, and then we start.
Sounds like a plan.
All right. You too.
Good afternoon, good morning, everyone. We welcome you all to this seventh webinar that is under Capacity Project. Capacity Project is funded by the European Union, and it has 5 partners that are working on this project. JCRC is the lead, and we are running it with 4 other organizations. We have the National Drug Authority, we have the National Council for Science and Technology, and those 2 are with JCRC in Uganda. We have Muhimbili University in Tanzania, and the 5th is the University of Coimbra in Portugal, and that is the coordinating site. So we welcome all of you to this 7th webinar, and we thank you for always being with us from the first to now. Today's session is going to be really interesting. We have some first-hand information from people who are cured, different from the rest where we've been having theories and having a lot to learn, but today we have it from the horse's mouth. With me today, the moderator for this session is Ms. Evelyn Hallow. She's going to take up with the 2 speakers we have. So enjoy the webinar.
Thank you, Anne. Thank you, all our listeners. Thank you for joining us today. This is our 7th beautiful webinar. Jimmy, thank you so much for joining us. I know Alan is joining us shortly in 3 minutes. When we talk about gene therapy, especially to our community, it still sounds strange, but it is good to bring science to community. The first webinar to the 7th, it has been science. So today we are having 2 people who have gone through the science to share with us their journey. Jimmy, please introduce yourself and let the people get to know you as you wait for your colleague to join us. Otherwise, to all our participants, you're most welcome.
Thank you. I appreciate it. My name is Jimmy Olahere. I am Nigerian, and about 5 years ago, I had the good fortune of participating in a CRISPR-based gene therapy for sickle cell disease, which has I want to be careful with using the word cured, but has functionally cured me because the gene therapy that I went through, scientifically or technically, I am still producing sickled cells, although I don't feel it again. And I guess we'll go into the science of my specific gene therapy during this chat. But to give you high level of what it was, why sometimes it's difficult to consider myself cured is because they targeted the expression of hemoglobin F instead of the actual sickle cell hemoglobin. So I'm expressing hemoglobin F, which we all do while we're in utero, but as soon as we're delivered, we start producing hemoglobin A. In my case, I started producing hemoglobin S. So they found the gene that is responsible for that expression of hemoglobin F, and it has been altered. That's why I'm functionally cured now. Like I said, so I don't feel any effects of sickle cell disease anymore, no pain crises, no organ damage, nothing. So yeah, I'm quite fortunate to be here. Thank you.
A lot, that is a lot to understand, especially when you say functional cure. But like you said, we are going to break it down. Today, we are not talking science. Today, we are talking community language. We are bringing science to the community. So we shall simplify the terms so that everyone gets to know what does it mean to silence this gene? What does it mean to increase this particular gene? But as we wait for Alan to join, Jimmy, what are some of the emotional and physical impact, the emotional and physical impact of the disease? Because now you do not have any complications of sickle cell, but what were some of the emotional and physical impact of sickle cell in your life?
Well, I mean, the emotional for me was definitely difficult. It was a mental toll to live with a disease like sickle cell disease, and it at times felt like I was kind of chained to a bed, which didn't really allow me to do much. So there was a lot of hopelessness, I should say. I felt really hopeless most of the time because I wasn't able to just go out and try to achieve the things, like everyone else. You are a human being and you have goals in life. And for the most part, if you don't have a chronic illness, you have the ability to attempt to go and achieve your dreams. But with sickle cell disease, I didn't even have a chance to fail, which, failure is pretty cool. It means you're getting to do things. I didn't even have a chance to go out and attempt things and fail. So that created a lot of hopelessness, which obviously would lead to depression and all of that. But physically, it was quite horrible as well. I had my gallbladder taken out. I had vascular necrosis on bilateral, both my hips, acute chest syndrome, pneumonia, pulmonary embolisms. Thankfully, I never had a stroke. I've gone blind. Just in every way, you read in a textbook how sickle cell disease can affect your organs. It happened to me. I almost lost my spleen, prior prism, the whole gamut, just having to deal with it was a constant breakdown, aside from just the pain crises that we've all come quite well, we all know quite well. Like I said, it also just felt like a breakdown of my body gradually. Every month, it was one organ or the other that wasn't performing the way it typically should.
That sounds very, very heavy because it's a lot of things happening to one person. That sounds very, very heavy. And it just makes us feel cold, even in the room where we are. You're saying you got your functional cure 5 years ago. In all the previous years, did you wish for a cure? And what is that particular moment that made you seek for a cure, especially knowing that the cure you're getting into is a trial? What is that one moment that led you to seek for the unknown?
So prior to receiving the transplant 5 years ago, and even maybe 2 or 3 years before even finding it, I had years before, absolutely, I had wished for a cure. I live in the US, so here there's a bunch of pharmaceutical companies that advertise their new discoveries on TV. And, every day sitting down in bed watching TV, you'd see all these cure for all these drugs, Alzheimer's, cancer, and there was just cures and there was TV adverts of it. And I just wished, like, man, how come no one's working on anything for sickle cell disease for years? That was my mindset. Man, I wish someone would put in some effort and cure this unfortunate disease. And then it kind of evolved into a place where I kind of got like jaded, not really caring anymore. So at first, I definitely wanted a cure. Then just from living with the disease, and I just got quite, what's the word I'm looking for? Like nonchalant. I really didn't care anymore. I'm like, you know what? You cure it if you want, cure it if you don't want. I really don't care. It's not my problem. I don't even wish to be here anymore. It's the disease that had taken a severe toll on me mentally and physically that I had just given up, so to speak. And it wasn't until my wife at the time had gotten pregnant with our first son, that my mindset started to change to, I think actually I would like a cure again. And fortunately for me at the time, which was in 2019, when I was about to become a father, I had also come across CRISPR gene therapy, which was perfect because at this point I was actually quite desperate to have a cure and be cured, because I wanted to be a father, and I knew sickle cell disease and fatherhood are not quite compatible, at least in the way I would like to be a father. I knew sickle cell disease was going to disrupt that. So, in an attempt to make sure that I am a present father here, not pass the burden of caregiving down to my children and all of what I've experienced as a sickle cell warrior, and looking at it from a caregiver standpoint, I was just terrified of what life would be like for my children, my partner at the time. So at this point, I was desperate for a cure, and lucky for me, the gene therapy, CRISPR-based gene therapy, was available for me, and I qualified.
So, Jimmy, when you say the statement that you've made, if I can quote you, I don't want to be here anymore. We have so many young people who are already in that kind of situation. Maybe later on, as we conclude, we'll go back to that statement for a word of encouragement. But as we wait for Alan to join us, during the time when you signed up for the cure, did you believe it will work? Did you have faith that it will work? Did you have doubts that what if it fails? Since it's new, everyone wants something that has worked. But for you, did you talk to people who had gone through it to have confidence with your family? Remember, you were saying you had a child coming along. Where did you get the energy and the faith to sign up for this?
Yeah, I am a man of faith, and I obviously prayed that this therapy would work for me. But thankfully, I didn't need faith because I had data. I had, like you had insinuated or alluded, I had spoken to patients that have gone before me. I was patient number four, so I had the opportunity to speak to the first patient ever to get a CRISPR-based gene therapy for sickle cell disease, the second and the third. And based off of the data that I had seen, I was able to extrapolate that this therapy was going to work for me as well. I was just like, there's no way it won't work. Everyone else I've spoken to, it's worked. Why would I be the odd man out? So in conjunction with my faith and just the data I had in front of me, I 100% knew it was going to work.
Thank
Oh, sorry, I'm not hearing. I think you're on mute. There we go.
Alan. Alan, have you joined us? I want to get Alan in. Alan, you're most welcome. If you can. Alan, if you are on, please raise your hand so that we can All right, Alan is there. Alan, you're most welcome. Alan, you're welcome. Please say something.
Yes, so hi, can you hear me?
Hear you, Alan. Can I get your, he's there. Jimmy, we are joined with Alan. Alan, please introduce yourself. The audience, we've been waiting for you. We've gone through the introductions and getting to know Jimmy and his journey. Please say hello to the participants and the whole audience, and then you'll be answering a few questions from our side.
Yes, good morning, good afternoon, and good evening, wherever you are. What a pleasure to be here. I apologize for joining a few minutes late. I was driving, so I was held up by traffic, but I'm really excited to be here. I didn't know this was going to be such a huge thing. I see over 170 people, so I'm so excited to be here again. So my name is Alan Biamukama, and I'm Ugandan, but I do live, I live in Massachusetts, the United States. That's where I live. And should I say I am one of the first people to have had this heart aging treatment or the gene therapy. And I was first in Massachusetts, so I really thank God for that. And it's also a pleasure to see Jimmy here this morning. I know we're in the same country as well. But I'm very excited, Evelyn, and I'll let you continue, and then I'll answer whatever questions you'll be moderating today.
Yes, Alan, I remember years ago we were having a chat, and you told me, Evelyn, if I can have a cure for 1 year, even 1 year without pain will be enough for me. Can you share with us some of the emotional and physical impacts sickle cell disease had on you as a person, the emotional and physical impact of the disease on you?
Well, sickle cell is not a fun thing to have, that I must say, for all the patients, the caregivers, or the parents. Even as a community, it creates a strain on people, you know. But from my own experience, it was very hard for me emotionally, knowing the fact that your life is surrounded by taking medications every day, or when you don't know when the next pain crisis will hit, or when you don't actually know when your next visit to the emergency room or to the hospital will be, but you know it's close by, you know it's near, you just don't know when. So that emotional thing, even the impacts that sickle cell brings, you know, death, pain, all those bad things it brings, you know, like organ destruction and all that. So that brings up, that eats you up emotionally, because first of all, you know, I have sickle cell disease. I'm going to be sick. I cannot do this. So the fact that you cannot even say, you know what, I'm limited because of what I have. I cannot be up, I cannot travel, I cannot go to school, I cannot, you know, play soccer, I cannot, you know, do anything because you think you'll be sick. Or for people that love traveling like me, I was always worried about, what if I get sick in in another country, in a country that's not the United States or that's not Uganda, what's going to happen? So that emotional pain does not settle well with people, it didn't settle well with me. Even the fact that society looks at you as someone who's sick, they know, oh, that's Jimmy, that's Alan. They have sickle cells. When I was growing up, for example, when I wanted to play soccer, they would not let me play soccer. They would be like, oh, Alan is sick, or Murade, meaning that one is sick, he will not be able to finish up. So that emotional toll is not really good. Plus also the physical part is not, it's really hard. It does create a toll on people as well. But it does not only affect us as patients, it also puts a strain on our caregivers or parents, because each time you go to a hospital, that's money, the financial part also is really hard, especially for people that are not financially well, for people that have to wake up and go to the hospital. So each visit to the hospital is money spent. So that also creates an impact. But to me, the fact that knowing that I have sickle cells, or I will die tomorrow, or I will die, it kind of resonated within my mind all the time, because I was like, each time I went to the emergency room and I was really, really sick, what if I don't go back home? Or is this the last time I may not survive? But yeah, it did really mess around with me so bad. But so that's what I can say. Thank you, Evelyn.
Alan, that is quite a lot. Your story is not so different from what Jimmy shared with us. The vesicular necrosis, the organ damage. What led you to seek for a cure, Alan? Because Jimmy is the fifth person to go through gene therapy. At what moment, Alan, did you say, now I want to seek for this cure? When you spoke to your doctor, at what stage, what was that moment, what was that complication that led you to seek for a cure?
Thank you so much again. So to me, first of all, I've had a vesicular necrosis. That's one of the things that I had to do. For those of you that don't know, a vesicular necrosis, it's when, and I'm not a doctor, so somebody can correct me, but some organs don't receive enough supply of blood. So like for my case, this was in my right hand, in my right leg, in my right hip. So I had necrosis of the hip. There was not enough blood supply on that side. So the bone started cracking up, which led to disability. I was walking with two legs, and then I started limping, and then by the time I knew, I'm on a crutch. That was a long story, but I ended up having a total hip replacement for that. But so that, and by the time I made a decision to go for the treatment, like you've asked, was when my health actually went down. It deteriorated. I was in and out of the hospital, and this was after COVID time, right from 2021, 2022 there. My health kind of went really, really down. I was in the emergency room every other day, I would leave today the hospital, and then the next day I go back. So I was in and out. The hospital became my second home, So my quality of life went really, really down. I barely went to work. I barely went to school. If I was not in the emergency room, I was at the infusion center, and this was every day. I counted how many times, I think this was in 2023, how many times I had gone to the emergency room and got admitted. In a year, this was like, I think it was like 48 times that is very, very abnormal to be in an emergency room or in a hospital 48 times just within 1 year. So I realized my health was going down, honestly. I was very sick, and life was meaningless, So and I got tired of everything. I got agitated. I was drained by the fact that um, things were on hold. I could not go to school. I could not live a normal life. Um, and then I decided to make this decision. This was during one of the visits with my doctor, Dr. Charles Azar at Mass General. And prior to that, the gene therapy was not even, it was still at a clinical trial. It was not even approved by the FDA by then. And during one of the conversations with him, between me and him, he asked me, if this gets approved, would you want to, get treated? Would you want to be the first one? I said yes, if it changes the quality of life, if it stops me from going to the hospital all the time, if I will stop worrying about organ damage and all those things, I said yes, I would want to do that. So that is what actually triggered me to be able to say yes to this treatment once it gets approved. And when it actually got approved, he called me and he said, "Do you remember what you said when I asked you last time? Would you still want to be the first person to do this?" I told him, Dr. Azar, I don't think I didn't stutter. I told him, yeah, what I said was true. I still want to be the first one to do this. So that actually is what made me change my mind or accept to go for this treatment. Like my quality of life had gone down.
Wow, Alan, that is really amazing. Back to you, Jimmy. Can I get you back? Jimmy, what was the hardest part during the treatment? And both of you will answer this. Jimmy, what was the hardest part during the treatment? And Alan, what was the hardest part during the treatment? If I see Alan clearly on the video, I can see your hair is growing back. Is that the first hair? Is that
Yes.
already?
No, this is actually I call it the normal hair. So for those of you that don't know, I'll answer your question and then I'll come to that. What
Okay,
was your question
yeah,
again?
Jimmy, during the entire procedure, what was the hardest part? And as you finish, we'll go back to Alan. What was the hardest part during the journey of treatment?
During the journey of treatment, what was the hardest part? So, it's kind of difficult to put my finger on one specific thing. So I'm just going to give you a couple of things that I would consider equally hard throughout the process of getting this gene therapy. First of all, for me, I had to get collected 4 times. I needed 4 collections. So that was extremely difficult to have to sit through a collection. It's a painstaking process where you get, at the crack of dawn, you get an injection of something called Prolaxafor, which stimulates the stem cells into your bloodstream. It can nauseate you or just cause some minor reaction, at least for me. I can't speak for everyone. And then you sit next to an apheresis machine for about 8 hours, and it kind of just separates the stem cells from the blood. And there's a electrocution process that you can actually feel. You're shaking nonstop. So I had to do that 8 hour collection 4 times. So that was quite difficult for me. There was also the conditioning, which was a week of Busulfan. And that was very difficult. The symptoms of the chemotherapy, the nausea, loss of appetite, the pain that comes from the chemo as well, the lack of energy, the mouth sores were unreal, were debilitating. So that was extremely difficult. And then actually for me as well, finally, I think the hardest part would be actually post-transplant, trying to deal with what life looks like after sickle cell disease has been quite a challenge for me, if I'm honest.
Alan, back to you. Alan, during the journey of treatment, I know we kept in touch talking about the numbers, but to you, what was the hardest part during this journey?
Yes, to me, first of all, I think what was really what was hard for me, the first of all is the patience, you know, because once you know you get approved and the doctor says at this date we'll start, you know, collecting your cells. I couldn't sleep, you know, I kept thinking about it. Uh, when is it going to be? When is it going to be? Because I was like, oh, I'm tired of being in a hospital. So the patience was paramount to that, was really a challenge. But circling back to what Jimmy said, that the process of collection is really hard. You have to and I mean the stem cell collection. You have to sit on a chair for like 8 hours, not moving, as they're trying to collect your cells that they will take for modification. So Jimmy said he needed 4. I needed 3. I needed 3 of those. So that's 3 times sitting in a chair for 8 hours nonstop, you know. So that was a challenge to me. The fact that I couldn't do anything, you know. And so that intensive preparation process was really hard for me. Also, another thing was the long hospital stay for me. Once we started the treatment, I had to stay in the hospital for a while. So that was a challenge, you know. Even though I got used to being in a hospital, but this was different, you know. This was now the actual treatment. So knowing that you have to be in a hospital for this period, this time. And also when I was in the hospital, another thing what was really hard for me was the process of chemotherapy. The process of chemotherapy was really hard for me, and I got the aggressive chemotherapy. I don't recall its name, but that kept me up all night because it did create so many wounds in my mouth that I barely ate. I barely swallowed anything for I think about 3 weeks, and I was struggling with that. So that was really hard for me, and also the emotional and psychological stress was you know, the fear of the unknown. Like, I was the first one, you know, in Massachusetts. I didn't want to be somebody's pig, you know, the experimental pig. I was like, what if it fails? You know, what if? Because they had done the trials, but they had not actually done the treatment. Guys, you know how you'd feel. So I was nervous. I was really scared. I was like, what if it doesn't work out? What if something happens? And the fear of the unknown was the main challenge to me. And also the physical and the recovery and the uncertainty. I didn't know how I would be on the outside once I get discharged, like how to be careful around people, what to eat, what not to eat, because the during the hospital stay, I was on a different diet. I had to be able to wear a mask around people. So that alone was really scary. But the actual process, the whole process, right from the collection, to waiting those 6, 7 months when the cells have to be returned after being modified or edited. And I was still getting attacks. I was still getting sick. I was still worried. And then beginning the actual process this year as well was something I really got worried about. Yeah. Over to you, Evelyn.
I remember when we knew the date and it had to be extended, and you were sick, and we barely knew at what stage, whether the date will arrive when you're still here. But if I can get back to Jimmy, throughout all, when both of you mentioned the harvest, one of the things that I remember mostly that is very, very painful are the needles, the injections that you get to stimulate the stem cells. But Jimmy, when did you realize that now you are okay? At what stage did you realize that now you are fine? And when did they tell you that now your numbers are okay? How did that feel?
Well, it was I think, roller coaster of emotions. I think I really started noting even before, as you know, the doctors are coming in every day, checking your numbers, making sure you've engrafted. And I think even before that, even before the engraftment, or a few days after I'd officially engrafted, I was noticing the lingering pain that I typically had with sickle cell disease was kind of no longer. I wasn't in pain anymore, the way I used to be in pain. And, you know, like I said, it kind of opened a different can of worms for me, because for so long, sickle cell disease is all I had known. Sickle cell pain is all I knew. I was just so used to, despite the fact that, um, my life was hanging in the balance many times. But the fact that it seemed like this transplant, this therapy, seems to be doing what the description said it would do. I'm not in pain anymore. Um, there was I think, a strange, how will I put it? There was just multiple emotions I was feeling at one time. I was happy that, man, I'm not in pain anymore. But like I had said before, I was still kind of grappling with what life would be like without sickle cell disease.
Jimmy, I can only imagine. Did you have a thought that what if it come? I'm not feeling the pain now, but is it going to sprout and come back? Is it going to come back? Did you have this thought that what if it is just imaginary? Is it going to come back?
Yeah, many times. There are many times I wondered about the durability of the transplant or the technology, if it was going to be long lasting. But similar to Alan, I was quite in a place where, for me, the unknown in terms of if this transplant will work or if there could be a potential to get some type of off-target effects, I actually preferred the unknown because the unknown was just better than what I had had. I'm in such a bad place health-wise that whatever this therapy would bring in the future is so much better than what I have now, despite the fact that I don't know what that is, because I'm such in a low point that I'm pretty positive that the fact that I'm going through this novel technology will put me in a better place than I am now, because that's how low I was, in just my thinking, my health, everything. So no, I wasn't afraid at all that it wasn't durable. In fact, like I said, like Alan, I was quite happy to only live for 1 year, 2 years, 3 years. I just knew that living a mundane, ordinary life where you didn't have to, deal with sickle cell disease, even if it's for a short period of time, was so worth it to me. I was quite comfortable being a guinea pig to figure that out.
So Jimmy, you are 5 years old as per your new journey. Alan, you are still in days. How old are you, Alan? And
I believe 4 months.
you are 4 months.
Yeah,
Wow.
so yeah, 4 months.
He is such a baby. Alan, it is 4 months. In the 4 months, when did you get to hear from your doctor that now, Alan, you are sickle cell free? Oh, you are fine.
Um, this
And what was that feeling like?
I believe this is before when I left the hospital. When blood, my hemoglobin seemed normal. I got pretty good numbers. For the first time in my life, my hemoglobin was 13. Um, it's never crossed to 10 before the gene therapy. I was always in the 9s and 8 and 7, and then I get transfused, and then I go back to 8 or 9. But for the first time, my hemoglobin is in 13, and it has stayed that way. So that and other tests seemed to be pretty okay. Um, those tests proved to me that the gene therapy was actually working. That's according to the doctor. So yeah, he said as long as your numbers stay like this and your blood work is okay, so that could tell that the gene therapy was actually working. And also from the look of things, I have not been in the hospital since I left. Even though I'm 4 months out or past after the gene therapy, but I have not had a sickle cell crisis since then.
Wow.
But before that, I was the mayor at the hospital. I was the mayor of the hospital because I was always admitted. But things have changed pretty well. I have not had a crisis since then. I don't even have to worry about a crisis. I can make plans for the next day and I execute them. I was before worried of making plans because I didn't know what tomorrow would be. I didn't know where I would be actually, whether I would be making those plans or I would be visiting a doctor. But I can now change things. I can plan with my friends. I'm like, hey, Jimmy, I'll see you tomorrow for dinner. And actually it happens. But I think it's working. The gene therapy is working. The blood levels look good. I'm curious what they will look on Friday when I go to see the doctor. Yeah, so things are pretty going on well.
I want to bring in this question, Alan, before you go off. Did you have a discussion with your parents that I'm going into this trial? I know your dad is online with us right now, and this question is, did you talk to your family? Because remember, we are talking about the unknown, sharing this kind of information to our community in Uganda. How was that discussion? What were his fears, your mom's fears, your family, your immediate family? What were their fears?
Yes, shout out to my parents. Shout out to my father. I see he's around. So I love you, Dad. But that's a good question. And yeah, I had this conversation with my dad, and he was like, okay, if before even this gene therapy, my father and I he's always supported me. And one of the hardest things when I was going to do my total hip replacement, that was different. He never wanted me to, because he had his own fears. He was like, no, what if it doesn't work? What if they put something that's not gonna work? Because we had that belief in Africa, when they put something in your leg, at some point, if it's not something of high standard of good quality, it's gonna have issues, like in a couple of months, in a couple of years. So there was a fear of that. But I told him, no, this was the United States, they do things differently. And so we came to a mutual agreement, but this was different. This was something that had never been done, or that has been done on few people as clinical, not as an actual treatment. So we prayed about it. Of course, it was a tough decision for him to swallow, but he said, as long as it makes your life better, as long as it's going to give you improve your quality of care, or improve your quality of life, he was okay with it. But I know maybe he was scared. They were all scared, even my mom, especially my mother. She was really, really scared. She was like, now what happens when they do this? What happens when they do this? How are you going to survive? Because you're alone, you're in a country, we're not there to support you. The fact that my parents could not join me here when I was going through gene therapy was really hard for me, because I wanted them to be here with me during this process. But things didn't work out as we had planned, because of like visa issues and stuff. But they were with me in prayer. And even on that day that I had the gene therapy, they were actually, they streamlined, they streamed online. So they watched the whole process from Uganda and Mass General. So they were able to see that. But it was really hard. And for every parent, it can be really hard for their children, especially if they're going for such, treatments, because you never know the outcome. But they were okay with it. But deep down, I know they were praying for me, for it to be successful. And it was, but it was not an easy decision for them, because they could not stop me. My dad was like, you're above 18, you can make your own decisions. Even if I say no, you will still go ahead and do it, if you want to do it. So he was like, as just, and it's not like I just woke up and made a decision. My father was actually very, very much involved. He talked to the doctors, like here. We made Zoom calls. He asked Dr. Azar and the team all the questions that he wanted to ask or to know, and they clearly explained to him how things will be. So that kind of fulfilled, or answered his questions, or his worries, or the concerns that he had. So they were involved, they were involved right from the start. They know the doctors, they talked to them, they emailed them. If they had any questions, they would reach out to Dr. Azai. Now, what's going to happen after this? The doctors were able to answer them. So that kind of fulfilled part of their concerns, or their worries. And the next they had to do was to just pray for me, to be able to have a successful treatment, and it did. So yeah, they were involved. They were worried about that, but that was taken care of.
Thank you. Thank you so much, Alan, for that. And now back to you, Jimmy. I know your wife was your rock as you moved through this. I know your family was, but now when you had a child on the way, how was this discussion of entering into a trial, being among the first 5 patients in the whole world? What was going on in the mind of your wife when you sat down to talk to her? The fears that if this doesn't work, yes, if it works, what were your fears, and how did your wife handle this?
She was quite supportive. For me, actually, I think she was almost the kind of the guardrail I needed because I was really, really keen on getting the transplant. I didn't even want to read the consent form. I just wanted to sign away. And I think it was my wife that forced me to read it. And I think, yes, I think you used the perfect analogy. She was really the support system that kind of made this possible because when we officially started in January of 2020, she had delivered our first child, and we also had the added difficulty of the pandemic to deal with. So it was just 3 of us in the hospital for about a year. Not in the hospital for the whole year, but the whole process took about a year going through it, and there's no way it would have been possible without her. Doing it on my own I don't think it would have worked because it's such a long process. I mean, it is possible, but thankfully I had that support system there in terms of my immediate family, even all the way down to my newborn baby who would lay with me on the bed there because, like I said, we were in the pandemic and it was just us 3 together. So it was fantastic. Like I said, I'm quite lucky. I like to consider myself one of the luckiest person with sickle cell disease because I've had good caretakers in my parents, good caretakers in my partner, and I'm thankful I don't have to make my children caretakers as well. They could just go and live a life and not have to worry about if dad's going to be okay. So yeah, I've been quite lucky.
Jimmy, I've spoken to a number of people who have gotten a cure, either from a bone marrow transplant, and now you and Alan. What is it like waking up and over 30 years that you've known have closed, and now you have been given a new chapter? What is it like? What has changed? Yes, the health has improved. What else changes when you receive a cure?
Everything changes. Every single thing and it takes a while for all of that to change. And you have to be quite intentional about it. For so long, I've always lived as a sick person because I was sick. I had a chronic disease. And one of the hardest thing to do is to come out of the transplant and not having to change that mindset of not being that sick person anymore. So all the coping mechanisms you've had to try to control or live with your illness are kind of useless now. So you have to kind of create new ones. Like you said a few questions before, it's almost like being born again. It's almost like I feel like I'm 5 years old. So it's a wave of feelings, positive and negative. The positives are you get this opportunity to create a new life, which not many people get. You basically get 2 lives in one, which is fantastic. And the second one that you get the opportunity to do it way better than the first one because now you have so much more control. But it also can be challenging, particularly after receiving a gene therapy quite late. I got mine at the age of 35, and sickle cell disease was basically the foundation of who I was. So to ask a 35-year-old man to kind of be reborn all over again is it can be quite challenging. And then there's also the added fact that depending on the kind of sickle cell disease you have, the most important skill set you'd have is just not dying, learning how to stay alive. And then at 35, once you've received this cure, you have to quickly build up the skill sets to
Transform
go
your mind.
on exactly and just go and live like a normal human being. But you have to remember, for 35 years you haven't been living like a normal human being. You've been in the hospital for
Yes.
48 times in 1 year, like Alan said. There's no way when you go to the hospital 48 times in 1 year you'd have the time to build up the necessary skills to be normal. So you have to do that quite rapidly. You have to make sure that you're in a place to provide for yourself, provide for your family. There's food. All of these things, they come rushing in quite quickly, and it can be quite anxiety inducing. So there are positives and negatives. But overall, I mean, given the fact that you've kind of overcome the disease, you've survived the disease, I would say it is overwhelmingly positive.
Thank you so much, Jimmy. We are on top of the hour. Alan, this is now to you. We have a very big audience from Uganda. I was sharing a few messages with my colleague here, Anne, and I was showing her messages from different platforms where people are saying this is not true. Even if it is true, it's not going to be possible. Alan, your words to people in Uganda, to people in East Africa, to people in Africa. I know Jimmy will come in, but we're on top of hour. We have only 4 minutes to the top of the hour where we shall let the audience now give you questions. And I know some of the things we've not discussed are going to be raised from the audience. Alan, to someone who has sickle cell listening to you right now, to a parent with 1 or 2 or 4 children with sickle cell listening to you now, what would you say to that person?
Thank you, Evelyn. I think to me, one of the things that have actually kept me strong is the faith, the faith that God really heals, God really loves his people. I'm a strong Christian. I've always prayed to God to, keep me alive every day, even though I had sickle cell disease. I always pray to God. I'm like, God, give me the strength, give me the life, So to those people back home, just have faith in God. I know sometimes it can actually be hard, but I never knew myself that I would have this treatment, I never knew I'll be before you to give my testimony that, science and that a miracle happened to me, Um, it's all about doing the right thing. If you're a patient, take your medications, do whatever the doctors tell you to do, and you can survive. I know there's that myth that goes around that people with sickle cells will die before the age of 18 or die quickly, or people with sickle cells cannot go to school or cannot do things. I refused to listen to that BS. If a normal person, someone who says normal can go to school, can do this, even you can do it. Even you as a sickle cell patient, you can do it. You're all the same. The only thing that separates you is you have a sickle cell disease, they do not, but you're capable to do anything they can do. So just keep the faith. Just keep the faith. I know sometimes some things can be hard, some days can really, really be hard, but look for resources, ask for help when you can, ask for help, look for those doctors, talk to them, go to the hospital even when you feel a slight inch of pain. Just make sure you attend to that, because you never know, it can blow very quickly, and then it changes everything. So faith works to me. It's been faith and God, honestly, and being resilient and being patient and being strong and being a go-getter. I know what someone can do, I can do better without even with the sickle cell disease. So I don't like the fact that people categorize us as weak and sickly, as people that can't do anything. No, that was way, way long time, but things have now changed. There is science, there is treatment. Seek that treatment and you utilize it. You never know. This gene therapy right now, I don't know when it will be in Africa, but advocate for those things. If we have people here in higher offices and, put them, you guys advocate for like better medical services, advocate for those hospitals to have medicine and to have doctors around, to have, those healthy centers, they have to be stocked with medicine. So if we have leaders here and, put them to work, guys, make sure that they do their job, they support you, they support all your healthy needs, but you never know what's going to happen tomorrow. This treatment can be in Uganda the next day, it can be in Nigeria, but until then, do what you have to do. Take your meds, go see those doctors and pray to God, you'll be okay.
All right, Alan, thank you so much for that. As we are going to go through the questions, and I know some of the issues that we have not been able to mention are going to come. I want to remind all our participants that we learn from history. We learn from history. When we go back to the journey and the theory of HIV, at one time, no one believed that Africans will have ARVs. There is a statement that they made that Africans cannot read time, they do not have electricity, where will they store the drugs? But the spirit of advocacy was not burned down, it was not put under. Many people advocated, and today, Africa, people are not dying because they don't have ARVs. And when it comes to Uganda, we lead because there was advocacy, there is research, especially a lot of research that you're going to find here at JCRC. In the same spirit, we are going to take the same torch in the sickle cell advocacy. We are going to take the same torch of advocacy, which was used in HIV, and bring it even in sickle cell. That yes, the trials are going on, they are still expensive, but this is what can be done in Uganda. This is what can be done at JCRC, that yes, cure research can be done here in Uganda and it will bring the cost lower. Let us not complain that the therapy is very expensive. Now, our message is going to be, how does it get lower? How can it be accessed by everyone? Let's go through the questions very quickly. There are those that are going to be the same, so we may not read everything. How can someone access gene therapy as of now? How long was the treatment? Let's go to, how can someone access gene therapy as of now? Because we have very few minutes, Alan and Jimmy, let's just give our answers very, very brief. How can someone access gene therapy as of now?
As of right now, if you live in Africa, unfortunately, you cannot access gene therapy. But that's going to change very soon. There's a lot of work going into making sure these therapies, like Evelyn alluded, are being manufactured on the ground there in Africa. And there's a lot of investments going into innovation that would allow this therapy to go in vivo, which means instead of collecting your stem cells, they just inject you with the CRISPR technology, and it goes into your hematopoietic stem cells, and it edits it right there in your bodies. So hopefully that could bring some hope in the near future.
Okay, thank you very much. Let us look at the next question, please. How long was the treatment course? Alan, how long was the treatment course? Very briefly.
So this treatment actually, to me, everything went through with my insurance. So it was done between the hospital and my insurance. But this treatment actually costs $2.1 million, I believe. And that's
Hey, that's it.
That's what it says. I think if I switch that to Ugandan money, that would be like 7 billion shillings.
That will be very scary. That will be very scary.
But yes, it's $2 million, which is really expensive.
Okay.
Very expensive.
Okay. The story of Alan and Jimmy is very emotional and touching. What is the total number of people that have undergone gene therapy? Are there female that have undergone gene therapy procedure as well? Jimmy, if you can answer this in less than a minute.
As last I checked, I believe between the two approved gene therapies in the US, Casgevy and Lyfgenia, there've been about 100 patients, a little over 100 approved by their insurance to receive the therapy. Although not all of them have received it because there's some bottleneck in the manufacturing process. So although we have people that have been approved to receive it, they still can't get it just yet. And yes, there have been female participants as well.
I have a baby with sickle cell. I know how hard life can be. What does it take for someone to benefit from okay, that one has been answered because you've answered it needs somebody to be in an area where the procedure is being done as of now, and that is US. Does your functional cure mean that your children do not have the risk of carrying the sickle cell gene in less than a minute? One of you can answer that, please.
No, my children still have the sickle cell gene because the gene editing was not germline, so it doesn't pass down. So my children have the sickle cell trait. And to the other question, aside from just the US, you can also access gene therapy in the UK and Europe as well.
Okay, thank you very much. What are the qualifications of gene therapy, and what are the requirements in terms of finance? I think finance this one has been answered. Based on what sickle cell patients go through, even the treatment is not approved, they will go for it. Are the treatment available now? I think that one has also been answered, where they are available in Europe and in the US. How long was the hospital stay? And after the harvest, what drugs were you being given, and why were they given the indication for the treatment? In less than a minute, one of you can answer this, please.
How long was the hospital stay? For me, I was in the hospital pretty much close to 3 months, I think. Close to 3 months, yes.
What is, to the participants, please do not forget, we have the evaluation questions. And to those who are participating, remember, this is webinar number 7. We have 3 more to go to our climax, where you will have your certificate. Please do not forget to work on the evaluation feedback. And some of the questions that we may not be able to cover because of time, they will be sent to Alan and Jimmy, and we will have them. We are streaming live on YouTube, and you can continue to follow, and the answers will be there. What are the negative outcomes of sickle cell gene therapy? Jimmy, very quickly, in less than 30 seconds, please.
Negative outcomes of gene therapy for sickle cell disease. I think for me, the overarching negative outcome that I've been able to ascertain from getting through this therapy is I think when these therapies are administered, when you get your infusion of your new stem cells, from what I can see, the providers really think that's it. That's the finish line, like we've crossed the road. We've quote unquote cured you. But I actually think that's where most of the work needs to be done in getting like a holistic approach to gene therapy is after your new stem cells have been infused into you. That's where most of the work actually needs to start. I think, and it's because that's the way science is. Hey, the goal is to create this therapy and give it to a patient, which they've done. But if we're going to cure people physically, we also to make sure that they're cured holistically as well. So when you cure them physically, I think it's important to do all of the hard work that would make them enjoy that cure. And for me, I think that's the negative part so far is that we're just curing people and kind of like, all right, peace out, go live life, and not offering that support that they need post-transplant.
Thank you so much, Jimmy. I know, Alan, you need to get off and go to work. You're already in office, but there is a question for you, Alan. Given the medical system in Uganda, if you were to take the risk to go through, if you were in Uganda, would you take the risk to go through the experience? Alan, in less than 30 seconds.
That's a good question. I think that would depending on my medical team, but I think I would do it, yes. Definitely. Uganda has really good doctors. It's the lack of maybe resources and machines and things like that might be missing or that could miss. But from my experience and the doctors that I've had, or the doctors that actually take care of me when I'm back home in Uganda, they are really great doctors. So I would utilize that, yes.
A quick one. This is from Dr. Lloyd, a BMT physician from Tanzania. Kindly share your advice to healthcare providers in resource-limited settings, and what policies or programs do you think would help more patients access gene therapy?
I think one is just making it accessible. I think policies need to be put in place to make sure that a disease that is considered rare in the UK and in the US could get a gene therapy off of the ground, and in a continent that bears the biggest patient burden, there isn't anything yet. To me, just doesn't make sense. So I think there needs to be a policy that fix that. And next time there's a disease that the patient population resides outside of where the technology is being created, I think it would be fair to have a policy that says, hey, listen, although we're creating it here in the US, but we also have to make sure that this clinical trial can be accessed by Africans. Maybe bringing Africans to the US or creating a site in Africa to make sure that they also benefit from the research.
Who is eligible? Who is eligible for gene therapy? very quickly, because that one answers so many questions here. Who is it?
Well,
You go, Alan.
yeah, I mean, anyone who has sickle cell disease, I think, is eligible. But from what I know, they have to do numerous tests to make sure that you qualify. I've had two of my good friends here. They both have a sickle cell disease, but unfortunately, they could not qualify for gene therapy for reasons I do not know. But there's a criteria that the doctors actually use, and I think also it depends. But these are my friends that are actually on high doses of pain like pain medications. They're like on high doses of pain medications, like dilaudid 16 milligrams. That's a lot. That's a lot of that's really high. For me, I would get a 2 milligram dose of dilaudid. That's my baseline. But this friend of mine is actually on 16 milligrams. So you can see his pain is really high. And I believe that's why he could not qualify for the gene therapy and other reasons. So as long as you have sickle cell disease, and that's one. And then the other tests they do, that is the discretion of between you and your medical team. That will decide that.
So there is a question, and Jimmy, this one, answer it very briefly. Have you heard of cases where gene therapy has failed?
I have seen in the data that there was, and I won't consider it a failure, but it was more like the patient continued to have vascular occlusive crises post-transplant. I believe there was one patient in the clinical trial that I had that the data showed that even though she had had her genes edited, he or she, I actually don't know the person or the gender, the person was still experiencing crises. So in a very minor, yes, very little. I've seen it, heard of it.
Thank you so much. Are there any clinical trials for babies? I think, do you think there are any clinical trials for children below 5 years in the US?
I don't think it's below 5. I think it starts at 12, if I recall correctly. From 12 and up. I'm not too sure on that though.
I'm trying to look through some of the questions intermerge. So I'm trying to look through anything that that has not been discussed. Thank you, Alan and Jimmy, for sharing. Did any of you ever use hydroxyurea? If yes, what was your experience using it? Had any of you tried other treatments like bone marrow transplant before going for gene therapy? I think let's answer that.
Yes, I was on hydroxyurea for a long time. I believe I started hydroxyurea in 2017. So I was on it for a while, but I had to get it off. I had to get off of it before the gene therapy, or when I was actually going to start the gene therapy process. I had to get off hydroxyurea. That's one of the requirements the doctors want you to do. You get off completely hydroxyurea, and then for them to be able to collect those cells. Bone marrow transplant? No, I never did that.
Jimmy, how long were you on hydroxyurea? Was it working for you or not?
I was on hydroxyurea for decades, probably 10, 15 years. Personally, I did not see an improvement in my healthcare or in my disease with hydroxyurea. That's why I decided, that's what eventually led me to gene therapy because I was still deathly ill quite consistently. And I had tried for a bone marrow transplant, but I did not have any match.
Okay. Well, What are the long-term side effects of the treatment? Jimmy, over to you.
Long-time side effects. So because this therapy is still so new, I'm not sure if Alan is, but I am enrolled in a follow-up study. So they're watching me for about 15 years, to make sure that the long-time potential side effects could be off-target editing, which is when they accidentally edit another gene or DNA, and there's a potential for blood cancer as well.
Okay. Yes, Alan, did you have something to say?
Yeah, there is actually also the possibility of infertility as well, in both men and women. That's also another side effect. So that infertility could come in. They would recommend you to use the sperm bank first as a man to keep your sperms away. But if you don't, there's that possibility as a man, and then cancers as well is likely to happen in the future. But that's why Jimmy is on a study. I'm also myself being still monitored for that. Yeah.
We are on top of the hour. We are going to share these questions to both of you, but Jimmy, to you, I know you're now the king of summits. What else is on the plate for you? What is on the plate for you now that you are able to climb the Kilimanjaro? You've just been on another high summit with Dr. Jennifer there and the team. What is next for you?
What's next for me? I think I'm taking it one day at a time. Right now I have, in terms of physical exertions or hikes, I have nothing planned yet. This the next to the end of the year and going into 2026, I'm just, taking it one day at a time. Focusing on me a lot and just continuing to improve myself and figure out who I am post transplant. So nothing out of this world or outlandish, just taking it one day at a time.
Thank you. Thank you very much. Alan, to you.
Yes, to me,
what is new for you? I know there is a lot to experience. There are new things, there are things that you've not done. What are those two things that are on your plate?
well, you can't say that things I've not done, Evelyn, because to me, I never considered I had sickle cells. I was like, if they can do it, I can do it. So, except mountain climbing, that I will never do, Jimmy. I'm sorry. But right now, I'm trying to finish up grad school next year. I believe that's something I wanted to do, focus on my career and also see where life takes me. I'm also just living the dream, excited not to be in a hospital. I'm very excited to be able to travel the world. I'll be in Middle East next year, and I love to travel. So to me, I will just live life the way it is, and keep advocating when I can. And I'm really excited to be finishing up grad school. My parents are really happy, as well as my partner. They're really, really excited that I have an improved quality of life. I also saw my brother here. He joined it, Conrad. Shout out to Conrad. So these are all people that have been there in my life, supported me.
Thank you.
But yeah,
thank you so
I'm just
much,
taking it day by day.
Thank you so much, Alan. Thank you so much. Alan, did you have something else to say?
No, I just want to thank you all for attending. If you have any questions, because I have to jump in another meeting right now. It's been a pleasure joining you this morning, Evelyn and Jimmy.
And we appreciate you. We appreciate you deeply. Thank you, Alan. Thank you, Jimmy. Thank you for accepting to be with us. I know we are going to keep in touch with you. This journey of advocacy is just starting. Thank you so much, Capacity. Thank you, JCRC, the IT team, the capacity coordinator. Thank you, everyone. Thank you to our participants. Please give us feedback on the form, and then we shall see you on our 8th webinar on the 3rd of November. Thank you very much. Have a beautiful week ahead of you.